Okay, this video is called Why Do Doctors Abandon Patients? Because I've had some viewers ask me this question. And first of all, there are some patients who really are crazy and inappropriate. They just want the doctor to give them drugs, opioids or something. So there is that category. But that's not what we're talking about here. Yes, that does exist. It's a very real thing, but that's not what we're talking about. We're talking about patients who've been followed by a doctor for some time. They have some type of chronic serious condition, and the doctor eventually doesn't want to see them anymore. And there's different reasons for why this can happen, but I'll just go through what I see as some of the common patterns in this problem. Patients tend to assume that doctors know a lot more than they actually do. The average doctor has an IQ of about 120. They are hard workers. They're very conformist. They do what they're told. They follow the rules, but they don't have much intellectual curiosity, okay? I know tons of doctors. Almost none of them ever reads, okay? I say that based on decades of experience with doctors. Very few ever read, because I talk to them all the time. Almost never do any of them ever tell me they just read a paper or a book, okay? There's a few really bright ones who do, okay? There's also some quite bright ones who are interested in talking about those things. But in general, the level of intellectual curiosity in the medical field is far below what the average patient thinks it is, okay? What else? The patients tend to assume that the doctor knows what to do. They think the doctor understands diseases, knows treatments, and if only the doctor would spend some time with them, they might get cured. They don't understand. There's a giant difference between diagnosing a disease and knowing how to treat the disease. Modern medicine is great at diagnosing disease. It's got lots of blood tests. It's got, invasive diagnostic procedures, colonoscopy, upper endoscopy, okay? Knows how to do biopsies, CAT scans, MRIs. It's got a lot of great technical stuff for diagnosing diseases, but it stinks at treating disease, okay? It's pretty good in the emergency room for acute problems where there's a clear problem and there's an obvious thing to do. Bone broke, must fix. Align the bones and the fracture will heal, all right? Drain the abscess and the infection will resolve, but it is not good at treating chronic disease, okay? Most diseases are caused by poor nutrition and by toxins. Doctors do not know anything, literally nothing, about nutrition or toxicology, okay? It's been my experience that, like I said, in just one day, I used to say a week, it's one day. I could teach any of these health coaches more about chronic disease, the common diseases, obesity, coronary artery disease, hypertension, diabetes. In one day, I could teach them more about those diseases than doctors learn in college, medical school, and residency, and fellowship. I say that based on a lot of experience, okay? Conventional medication and medicine in many ways is a big joke. What conventional medicine does is it takes all these common diseases and it defines them as chronic, which I find very amusing. So by defining a disease as chronic, what they're saying is it is impossible to cure this disease. They will define hypertension as a chronic disease of unknown cause, impossible to cure. It's a walk in the park to cure it for most patients, especially, when it's caught early. When they've had it for 30 years and the arteries are damaged, it's harder to reverse it, but it's still quite often reversible. So what I'm trying to say is there's a very good chance your doctor does not know what to do, does not understand what causes your disease, and doesn't know how to treat it, okay? Let's see. Doctors are, like I said, very good at diagnostic tests, at prescribing drugs and surgery. Some of them are great at that. And they get paid for doing those things. That's how you generate billing codes. You do a billable test, prescribe a billable drug, perform a billable surgery or other intervention, okay? They don't get paid for curing the patient. In fact, it's considered irrelevant. It is very, very rare that anybody even keeps track of what happens to the patient. And by that I mean in research study, they might take our outcomes. This is what happened to the patients in this cohort. This is what happened to the patients in the other cohort. But in general, very few. Like, for example, I've been in medicine over 30 years. I have never, ever been in a conference where the person running the conference said, look, we're doing good with our hypertensive patients. We're curing 50% of them. We'd like to cure 60%. I've never heard that in my entire life, okay, ever, in all the surgery services I've been on and the other services that I've been on. I don't hear that, okay? What I'm trying to say is if you were on a sports team, baseball, football, basketball, tennis, any sport, you would say, how are we doing? Are we winning more than 50% of our games, 60%, 70%, 80%? The best coach wins the most game. And in medicine, it should be the same way. the best doctor cures the most patients, but it's not. It's not even talked about typically. Outside of a research study, you will almost never hear anybody talk about that. There'll be some doctors interested in doing research which will be keeping track of outcomes, for their own research purposes, but on a wide scale, it will never be talked about. And then you will say, well, what do the big shots in medicine talk about? Let's say somebody owns a hospital. What do they talk about? They don't talk about curing patients. That's considered irrelevant. They will talk about productivity. This year we performed, 100 operations on the pancreas. Therefore, we are a high-level expertise center on the pancreas. Simply going by their numbers, not going by whether or not they actually help the patient. Okay, it's sort of an assembly line industrial model of care rather than what works. Okay. So what I'm trying to say is Big Pharma doesn't want patients cured of chronic disease. For example, if they give you a medicine for hypertension, diabetes, gastroesophageal reflux, whatever it is, they get money out of you every single day. If you're cured, you don't need them anymore. They don't get any money. So there's no incentive. And Big Pharma kind of controls the whole show. They're like at the top of the pyramid, which controls medicine. They sort of make the rules, make the guidelines, and then the doctors at the Ivy League schools who write papers get their grant money from Big Pharma. So they have to please Big Pharma. So in the end, what Big Pharma wants, Big Pharma gets. Okay? And so what I'm trying to say is, what's the point of all this? The point is that the patient just wants to get better. They want to decrease their pain, their suffering. And what I'm saying is, when the drugs and surgeries fail, as they often do, the doctor doesn't know what to do. The patient goes to the doctor saying, please help me, but the doctor doesn't know what to do. They've run out of their bag of tricks. Drugs and surgeries, this is, in a usual metaphorical sense, that's pretty much what happens. The patient's persistent questions are a reminder of their failure to be able to help. And they don't get paid for just talking to the patient. Typically, they don't. I mean, there may be a psychologist does or something like that. Maybe a psychiatrist does. But in general, most doctors, they're paid to prescribe diagnostic tests, drugs, and surgery. In general, those basic things. So they're not getting paid. The patient keeps saying, well, I'm not better, I'm not better, I'm not better. They'll tend to, refer them maybe to somebody else. But the patient's almost surprised. Well, why wouldn't you talk to me? You were so friendly when the relationship, doctor-patient relationship just started. And what I'm also saying, too, is a lot of this social stuff, doctors are afraid to talk in a specific, detailed, personal way about religion. They might make a general comment about religion, but they don't want to get into it in a personal way. They don't get paid for that. They're afraid they might offend the patient. They might get in trouble for that. So once you're done with drugs and surgery, there's not much else they have to offer most of the time. Okay? And so a lot of times the doctor just feels like they've got nothing else to offer the patient. Go see a psychologist, go see a psychiatrist or something. And so here's some of the points I would make, is that if you know about nutrition and toxicology, there's almost always more that you can do. Reduce the dietary fat, avoid these toxins. People are exposed to tons of toxins. I mean, we're not going to get into it right now, but I could very quickly rattle off 30 toxins that people are commonly exposed to. And a person can make an effort to avoid all those. And that is what the intelligent person does. But most people are not too smart. Most patients are cognitively impaired, mentally slow, no curiosity. That's the vast majority of them. I can tell you the vast majority of patients in any hospital in the United States are a bunch of functional illiterates. And the relevance, and I also know, a doctor does not have a lot of time. And when a patient starts rolling their eyes and, acting annoyed and stuff, I can tell you, most of the time when I'm talking to a patient and I start talking about diet and toxicology, they roll their eyes at me. They're like, why are you wasting my time with this BS? They want a quick fix. They want a drug or a surgery. That's what they expect. They're sort of trained to expect that. And the paradox is that the average patient thinks that drugs and surgeries are the answer. They don't cure hardly anything, okay? But that's what the patient thinks. That's what the patient expects. That's what the system rewards. So that's what happens, okay? And, like I had a guy in kidney failure, and actually his friends of his family knew one of my friends, and they asked to talk to me, okay? So I talked to the guy, and I'm like, well, okay, you're in kidney failure right now, but potentially it might be reversible. So let's just talk about the kidney. What does the kidney do? The kidney's main job is to excrete nitrogen. So if you increase, and as soon as I started saying this, the patient gave me this annoyed, sort of pissed off look like I'm some type of idiot. No, I'm like, you have a problem with your kidney. Let's understand the kidney so we can help the kidney. And it was kind of a bizarre experience, but I've had it so many times, I'm no longer surprised by it. That's the obvious intelligent thing to do. How can we protect the kidney? By decreasing its workload, enabling it to heal, avoid the animal protein so it doesn't go into hyperfiltration, reduce the amount of protein intake, thus reducing the nitrogen intake, thus reducing the workload of the kidney so it has some time to heal. I mean, that's an obvious intelligent way to talk, but I can assure you it is not commonly done. Okay, and a lot of patients don't like it. So the sad truth is most patients want a quick fix. They expect a drug or a surgery, but there is no quick fix for most problems, and most patients have bad outcomes. The United States spends more, I think, than any other country in the world. Certainly it's up there if it's not the most. I think it's the most. And it has lousy outcomes. The average person in America does not age well. Like I said, my internal medicine friends tell me, some of them, that every single one of their patients over 60 is mentally slow, abnormally mentally slow. I've had some tell me the vast majority of their patients in their 50s are abnormally slow. I can also tell you, I have a lot of doctor friends. A lot of them are fat and cognitively slowed down in their 50s. Doctors, okay? They don't know what to eat. Don't get me wrong. I know some doctors who are in fantastic shape and they're aging great, but they put a lot of effort into that, okay? But what I'm trying to say is, unless a person learns about diet and toxicology, they're most likely going to be fat, sick, and stupid by the time they're in their mid-50s and afterwards. Okay, that's just what the Western diet does to people and the common toxic exposures in the Western diet. And, the old saying is, for a person who eats a low-fat vegan diet, they don't need a doctor. And for a person who doesn't, there's no doctor who can save them. And, of course, that's an exaggeration. But the point I'm trying to make is, a lot of times when a doctor bans a patient, it's because they feel they've got nothing left to offer and they don't have any interpersonal skills, and they don't have any interpersonal skills to improve the situation further at that point. And they can't talk about religion. They don't know nutrition and toxicology. So they feel they got nothing to offer. So then they just, sort of avoid the patient. And I'm not saying it's right. I wish they would do more for the patient, but the truth is they don't know what to do. So it's kind of a sad thing. And that's why I think in the end, a patient, the people who have the best outcomes are the ones that are very assertive about learning everything they can about their disease and doing whatever they have to do to get better. Like I said, I know my doctor friends, my old aunt, she's 78 years old, fractured her hip when she fell down. She signed out of the hospital. She needed the surgery, open reduction, internal fixation of the hip fracture. And as soon as she had the surgery, first day, she signed out AMA, against medical advice, because she just figured she'd take care of herself. Once the surgery's done, she doesn't want anything else to do with the hospital. Another buddy of mine, a real good general surgeon, he's also trained in vascular surgery to a large extent. He actually, this is a long time ago now, about 30 years ago, he went for open heart surgery, and he left the hospital on first day post-op. As soon as he's extubated and had his wits about him, he just went home, okay? And now he's a surgeon, he knows what to do. But what I'm trying to say is, this assertive, I'm in control of my own fate and destiny and care, those types of people do incredibly well. Maxwell Maltz had the same experience with it. So anyways, for what that's worth,